This is the primary survey. EMS arrives on scene of a call for a 30-year-old female patient with shortness of breath. On arrival, EMS dons BSI PPE and ensures that the scene is safe. Once at the patient, EMS can note audible wheezing, and the patient is in the tripod position. Patient states that a prescribed inhaler has been empty and she has not refilled it. EMS takes note that she is able to speak more than 2 words per breath, and her airway is currently patent due to her speaking. She is obese, weighing approximately 300 pounds at a height of 5'5". She is red in her face. Instruct my partner to apply a high-flow O2 via non-rebreather at 12 liters a minute, and I continue my assessment. She is alert and responds to verbal stimuli, and she is speaking in an oriented manner. She is slightly tachypnic with 24 breaths per minute and has an increased heart rate of 110. Her radial pulse is regular and strong. Her initial SaO2 reads 90%. Patient states that she is not in any pain, but this bout of shortness of breath started about an hour ago. But she was hoping that it would get better and she wouldn't have to call an ambulance, and that's why she waited. She was sitting watching TV when it started, and she states that it helps her breathing if she sits up and forward. My partner states that upon auscultation of lung sounds, he hears wheezing. As I prepare a duo nebulizer T-pipe of Atrovent and albuterol, I'll ask the patient if she has any allergies. She replies that she is allergic to penicillin and shellfish. Her other medications are insulin and Prozac. She does have a history of asthma, which she states is usually controlled with her prescribed inhaler, and that she ate breakfast about 4 hours ago, and she's sure that it's not shellfish. She takes the Duo Neb treatment. After she's inhaled the medication, her skin is less flushed, and her breathing has slowed to 18 breaths a minute. While her pulse is about the same at 108 beats per minute, her pulse oximetry is now 98%, and she's just on room air now. She took off the mask and she's feeling better. And we re-auscultate her lung sounds, and they're clear. Since she takes insulin, we go ahead and offer to check her glucose for her, and it's at 130. Patients stated that she does feel better, but we talk her into going to the hospital in case her asthma is aggravated again, and that would be bad since she doesn't have her inhaler. She agrees to go, and EMS transports patient to the nearest facility and reassesses the patient every 15 minutes.